Hello, this is Mrs. V, and so in this video we are going to cover our way through the lymphatic tissues and organs. The lymphatic vessels are covered either in class or on another video. So in studying lymphatic tissues and organs, usually they're divided up into primary lymphoid organs and secondary lymphoid organs. The primary lymphoid organs are the bone marrow and the thymus gland. The primary lymphoid organs, this is where lymphocytes are made or where they mature. We learned that hematopoiesis, that formation of all of the blood cells, occurs in the red bone marrow in spongy bone. And in bone marrow, that is where both T lymphocytes and B lymphocytes are made, but the B lymphocytes, which make antibodies, that's a lot of Bs, they are going to stay in the bone marrow and mature there. And then when they are released from the bone marrow, then they are a naive B lymphocyte, meaning they have not met their antigen yet. T cells, they are made in the bone marrow, but then they go as a pre-T lymphocyte or a thymocyte, they go to the gland of the thymus and they mature there. What's distinctive about primary lymphoid organs from secondary lymphoid organs is that there is no immune response coming from the primary lymphoid organs, meaning that we're not going to be fighting infection from the bone marrow or from the thymus gland. So this picture just kind of shows you I want you to sort of visualize what's happening. So we're getting these lymphocytes, they're going to be made in the red bone marrow. And these are white blood cells. So white blood cells move. They're going to be released into blood. They can leave the bloodstream and go into the tissues, and then they can go into the organs. So B lymphocytes, they're made in the bone marrow. They mature in the bone marrow. They circulate in blood, in tissue fluid, and then through the lymphatic system. T cells, they're made in the bone marrow. Then they go to the thymus, and then they can circulate in the blood, the tissues, and lymphatic tissues and organs. The secondary organs or the lymphatic tissues, this is going to be where we are going to fight infection. So that is where the B cells and the T cells, they're going to circulate through the lymphatic system. And think of these lymphocytes. This is part of our adaptive immune system. It is specific. Each one of your lymphocytes is like an assassin. They will respond to one particular antigen. So think of just a piece of the bacteria that cause strep throat, so Streptococcus pyogenes, just one part of a rhinovirus that causes a cold. They are specific. They're looking for their soulmate, their one true antigen, or their assassination target, however you want to think about it. Where they're going to go to encounter their antigen and initiate immune response, so think like they're going to hang out at the coffee shop, is going to be these lymphatic organs and tissues. So thymus gland, it is a bilobed organ. It is shaped like a butterfly. It is in the mediastinum, so not to be confused with the thyroid gland that's in the anterior neck below the larynx. And it's a part of endocrine, and I said that we would pick it up here. So the types of cells, we know we have our pre-T lymphocytes, so our thymocytes go to the thymus. There's also these epithelial cells. Remember, epithelial cells secrete things. They're going to be making those hormones, thymocytes collectively, that are going to bring about the maturation and then the differentiation of these T cells. Another way to say this is they're going to mature and they're going to be educated. So big thing, thymus gland does not fight infections. This selection process is brutal. We'll look at it in just a second. Only 2 to 5% of those thymocytes that go to the thymus will actually leave. And when they leave, they look like little T cells. All lymphocytes look alike, but they're going to leave as a naive T cell waiting to encounter or to meet their one antigen that they were designed to respond to. What's weird about the thymus gland is that it grows through infancy, childhood, and up to the point of puberty and adolescence. It increases in size. After that, it starts to atrophy. I don't even have a model that has a thymus on it. What happens, it's called thymic involution. And it goes from active functioning tissue that's generating T cells, T lymphocytes, and that functioning tissue gets replaced with adipose tissue and connective tissue. What's happening, this maturation process or T cell education, T cells, these T lymphocytes, they have the ability to come alongside your cells and kill them, to cause them to go through programmed cell death. We kind of want them to understand or to not go rogue and cause autoimmune reactions. So the first thing they have to do is learn how to recognize self. Each one of your cells, except for your red blood cells, has a special surface protein, so an antigen called a major histocompatibility complex, so MHC. And think about it like your own personal barcode. And what's going to be unique about the T cells is that they can only recognize something when it's in context of this barcode. So they really need to learn the barcode. So that positive selection, if they can recognize the barcode, then they can go on to the next step. If they don't recognize self, then they're going to die. So they're going to go through apoptosis, so cell death. This next part is called negative selection. And negative selection means we don't want a T cell to recognize one of our self antigens. And I realize this picture looks kind of confusing. It's like, well, wait, first we want them to bind, but then we don't want them to bind. The big thing is any one of our surface proteins, glycoproteins, sugars, anything that's us, we don't want them to get excited about bind to, because then we're going to have a lack of self-tolerance. We're going to get an autoimmune disease. So we don't want them to get excited and bind too tightly to something that is just us, so a self-antigen. So once they go through this, and like I said, only about 2 to 5% leave, then they're going to get their job. They're either going to be a T helper cell or a cytotoxic T cell. So once mature, these lymphocytes, they are going to leave. They're going to circulate bloodstream, tissue fluid, and then they're going to gather in those secondary lymphoid organs to meet their one true antigen. The two populations of T lymphocytes, so CD4 cells, so the cell determinant, so when they leave, they get their little marker. This is a T helper cell. And think of T helper cells, they're like the generals of your immune system. They're going to direct and control our immune response, and they do that through cytokines. The other cell type that's made are the CD8 cells, and these are our cytotoxic T cells. These are our killers that can kill our cells that have been infected by a virus or are cancerous. So these two cells, they're going to work together for our cell-mediated immunity. Cell-mediated immunity. Okay, so let's start coloring. All right, so our primary lymph or your organs, so the bone marrow. And notice I colored it just here in the proximal epiphyses. So this only occurs in red bone marrow. And in adults, the only place we have our red bone marrow is going to be the proximal epiphyses of the humerus, of the femur, and then in our flat bones, particularly our hip bones, sternum, are examples of flat bones. So site of hematopoiesis and the site of B lymphocyte maturation. I went ahead and colored the rest of this yellow because as an adult, we have yellow bone marrow, so fat. When in utero, it's going to be the yolk sac that makes blood cells, then it's the liver and the spleen, and then when a baby's born, they have a bunch of red bone marrow, but as we age, we lose that, and we just have it in the proximal epiphyses and in those flat bones. Our other primary lymph organ is the thymus. So that bilobed organ secretes hormones, so thymosines, that are going to drive T cell lymphocyte maturation and differentiation. So now we're going to go through our secondary lymphoid organs, and these house immune cells. That's where all our immune cells are going to meet up, and where lymphocytes encounter their antigen, and we are going to initiate an immune response, and they're going to get activated. What secondary lymphoid organs have in common is that they visually, you can see these little things, they look like little purple olives. This is a tonsil, but they have these lymphoid follicles. Some textbooks call them nodules. They're basically visually distinct clusters of lymphocytes. They usually have this little center, which is called a germinal center. What's happening in these organs is every cell we need, so cytotoxic T cells, helper T cells, B cells, plasma cells, which make antibodies, macrophages, dendritic cells, they're all going to hang out in the secondary lymphatic organs. So all cells necessary for adaptive immune response are there. Lymph nodes are the principal lymphoid organ, meaning that's where most of this is going to happen. They have the job of, they're going to filter foreign material. So lymph is that fluid that's inside the lymphatic system, and they are going to dispose of pathogens, cellular debris. So their job is disposal. So they can have like a bunch of little filtration units. What's happening is what's called immune surveillance, meaning the lymphocytes are looking for their one true antigen. And when they meet up, that antigen encounter, we're going to get an immune response. So we have our B cells there. When they get activated, they become plasma cells and make antibodies. T cells become activated and they become those cytotoxic T cell killers. We also have our macrophages and our dendritic cells there. Those are our immune scouts. Those are our antigen presenting cells. They are necessary to present that antigen to the T cells. Also, when we have an infection, these are going to be sites where the lymphocytes that are specific for that pathogen, they're going to make a clone army. So it is also a site of lymphocyte production along with the bone marrow. And you can watch that later. The structure of a lymph node, and actually, to be honest, all of the lymphoid organs, is going to be predominantly reticular connective tissue. If you remember from AP1 or your study of histology, reticular tissue has sort of the consistency of a spider web, or sort of think of a spread out steel wool. It makes this meshwork. And connective tissue, we have these fibroblast cells, and they are going to make a type of collagen that makes this network. It's kind of showing you the nucleus, and this is the collagen fiber, and the cell membranes just kind of cover those collagen fibers. They are going to basically make a road system for lymphocyte migration through secondary lymphatic tissue. And the particular fibers, they actually communicate with the white blood cells and say, hey, we've got an infection, so they respond to inflammation. But you can kind of see we've got our macrophage there, we've got our lymphocytes, and so all the cells are going to kind of travel along these reticular fibers. We know that when there's an area of infection, that the lymphocytes are going to respond, and when they start to reproduce and they start to respond and fight infection, they are going to make a bigger army. So this takes room, and so the lymph nodes can actually increase in size up to 10-fold. It's called lymphadenopathy. Have you ever heard somebody say, oh, my glands are swollen? And usually the ones that are swollen are going to be the site that is draining an infection. So if you have an upper respiratory infection, usually you can feel the swollen lymph nodes or lymphadenopathy in those cervical lymph nodes. Any place they're superficial, you can feel them. As far as lymph node structure, they have a complete outer fibrous capsule. That fibrous capsule then makes these partitions called trabeculae, and so there's an outer cortex and an inner medulla. The big thing about them, we have many inflows, so efferent vessels, and we have one outflow. Also, in the cortex, we have those germinal centers, and at the center, this is going to be where those B cells that when they become activated become plasma cells. They're going to divide here, and then plasma cells make antibodies. And so we have antibodies to things we have been exposed to in the past, and those long-term plasma cells live there along with the B cells. There are a lot of sinuses, so kind of think of as the lymph flows through and the white blood cells go through, they kind of percolate through the sinuses, and like I said, they leave out that one efferent vessel. You have roughly about 600 lymph nodes scattered throughout the body, and it's highly variable. They vary in size and location. There are some places that they're superficial, so cervical in the neck, axillary armpit, and inguinal in the groin where they can be felt. But they are everywhere except some avascular places like your teeth and your cornea, and then you don't have any in your bone marrow. So on this diagram, I did not color my lymphatic vessels. That's just too tedious. So just go ahead and label lymphatic vessels. And we know that lymph is picked up by the lymphatic capillaries. They merge to form larger vessels, these lymphatic vessels. And these lymphatic vessels are going to transport lymph. And along these lymphatic vessels, that's where we're going to find our lymph nodes. Go ahead and label lymph node. And so you can see all of these little bean-shaped structures. So remember, they have an outer capsule, fibrous outer capsule. Go ahead and color that. The other thing, notice that there are many arriving vessels. So the word for arriving is afferent. A and A. So A for arrival. And then there is one efferent or exiting vessel. What this does is it increases the pressure inside the lymph node and forces lymph through the lymph node. This is a very low pressure system. And so this is just our way of filtering that lymph in each one of the lymph nodes. So that lymph gets filtered over and over again. The lymphocytes are there, the other white blood cells are there, and the job is to remove debris and protect the body against pathogens. So we've got the trabeculae, and then on the outside we have those germinal centers. If you want to color those different. And then we have an inner medulla, where we have sinuses in the lymph nodes, so that's where the lymph and the white blood cells sort of travel along those reticular fibers and exit out. And then, like I said, they'll move through lymphatic vessels and it will get filtered over and over again. There are clusters of lymph nodes where they are just below the skin, so they're superficial. So when there's lymphadenopathy or they're swollen, then we can feel those. So cervical lymph nodes are in the neck. They become swollen, lymphadenopathy, when there's an upper respiratory infection. And I'm sure you've probably felt that at some point in your life. There are a group of lymph nodes in the armpit, the axilla. So they're called axillary lymph nodes. And these are the ones, if a woman has breast cancer, they will remove some of these lymph nodes and send them off to pathology and look for cancerous cells. This is one of the factors in grading the stage of breast cancer. When these lymph nodes are removed, it causes a break in the chain. So what happens in breast cancer patients, that they often get lymphedema in the arm from the side where those lymph nodes were removed. Then in the groin area, and the anatomical name for groin is the inguinal region, so inguinal lymph nodes. These would become swollen, so lymphadenopathy, if there's infection in the leg, so the lower limb. So inguinal lymph nodes. In the other lecture video, we watched this, just kind of reminding you that sometimes lymph nodes can become infected. So this is different from lymphadenopathy. When there's actually an infection inside the lymph nodes and they fill with pus, that is actually called a bubo, and that bubonic plague is named because that is one of the signs, it's buboes. Our next organ is the spleen. It is the largest of the lymphoid organs. It has a capsule. It filters blood, so it's a lot like a lymph node, except instead of filtering lymph, it's filtering blood. So as far as its immune function, there are two parts to it, and when things look different visually, they have different functions. So red pulp, the red part, that's where we are removing those worn out red blood cells. Remember, they only live about 120 days. Platelets also, they have a short life, about 10 days. And then just filtering the blood, removing cellular debris is going to be occurring. The spleen also stores blood. It stores red blood cells, platelets, and monocytes, and they can be released from the spleen if they are needed. White pulp, think about white pulp, they're just forming a cuff, or they congregate around a central artery. What you're going to find, we're going to get our lymphocytes, and this is our site of immune surveillance and activation in response to bloodborne pathogens. Like I said, very similar to lymph nodes, except we're worried about bloodborne pathogens. All the cells that we need, so macrophages, dendritic cells, you can find those in red pulp and white pulp. Sometimes the spleen has to be removed. That's called a splenectomy. And so visually, you can kind of tell the difference. Histologically, we always do a right stain, so you don't get the red and the white, you get purple and pink. So, but you can see it has lymphoid follicles like lymph nodes, except we're filtering blood. Go ahead and color our spleen. It's over in the upper right-hand quadrant, tucked up underneath the diaphragm behind the stomach. So filters blood, monitors blood for pathogens. White pulp, immune surveillance and activation, initiation of immune response. Red pulp removes old red blood cells, stores blood, platelets. It is a fragile organ and easily ruptured. Trauma, infection. The rest of the tissues we're discussing, they kind of lump them together in what they call MALT. So mucosa, associated lymphoid tissue. Remember, mucosa, your mucous membranes are your inner lining. So any place you can stick your fingers in your body that's moist and warm, it's covered by mucosa. And it kind of makes sense that you'd want some immune surveillance, so just in that lamina propria, just underneath epithelial tissue, it's a good place for immune surveillance. So you protect your doors and windows. It defends portals of entry. So your gastrointestinal tract is a big portal of entry. So we have these special lymphoid tissues called pairs, patches, in the small intestine. That's where our food is absorbed. So they're going to respond to ingested substances. Let's go ahead and color those. So pairs, patches. They're actually in the most distal part of the small intestine called the ileum. Also in the gastrointestinal tract, so you've got the small intestine, and then that's where all the digestion and absorption occurs, and then your food moves into your colon or the large intestine. That's where waste is going to be formed and then exits out the body through the rectum. So right here at that junction, there is something called a vermiform appendix, and the appendix has, once again, those lymph follicles or nodules, and it is going to protect against things entering the colon. Another function of it is to sort of serve as a bacterial reservoir of our good bacteria, so our normal microbiota. Problem with this organ is that it doesn't stretch well, so appendicitis, if there's inflammation, they'll just remove it rather than risk it splitting and exposing the peritoneum to harmful bacteria. Go ahead and cover our appendix. It wasn't on this picture. I had to make one. So blind-ended sac, bacterial reservoir of our good microbiota. If rupture leads to peritonitis, which can lead to death. Tonsils are basically a ring of lymphatic tissue sort of surrounding our respiratory airway, so nose and mouth entry. So either inhaled or ingested substances. And they're really incomplete fold. There's not a capsule, but you can once again see our lymphoid follicles with those germinal centers. Your pharyngeal tonsils in the nasopharynx, lateral sides of the soft palate, you have your palatine tonsil, and the base of the tongue, you have your lingual tonsils. They have these crypts that's unique about them that increases surface area and basically invites things in to mount an immune response upon entry of a potential pathogen. So go ahead and color your tonsils, protect against pathogens entering through nose, through air, and through mouth, through food. Okay, that's it. So make sure your name is on your paper. The link to the Dropbox is in D2L. You can find it through your checklist or in news. Have a great day.